Good morning. It is the morning of day 9. I chose not to record yesterday after work because I saw some things that I was really bothered by and was spoken to pretty disrespectful. And I thought I needed to calm my emotions a little bit so that you guys didn't really see that rawness. Thankfully, a very, very good friend of mine, I could talk to her and tell her what happened, and she gave me some advice about just let it sit for a little bit. I think that was probably the best advice. But I have been giving these nurses the benefit of the doubt because I thought, they had been dealing with some really rough situations, and they were tired, things like that. So I was giving them the benefit of the doubt of what I've seen. But now that there is more nurses there than there are patients at the current moment, I have seen some behavior that I am appalled. I've seen some pretty bad nursing, no doubt, wherever I've worked. There's always good and bad nurses. But how I have seen majority of them treat the patients is appalling. The hospital that I'm at is in the ghetto, which I don't have a problem with because I've never had a problem with that. I don't care what type of patient I'm on there. I treat them as if they're I want my family to be treated. I don't care if you're the bum on the street or the Queen of England. I'm going to treat you the same. Don't get me wrong, if a patient disrespects me, I'm going to put them in their place. They don't get to disrespect me. And I have said a couple choice words to patients if they're disrespectful. But there is a way to treat people with respect and with dignity. And what I have seen is that they do not treat these people with dignity. And I'm not the only one that has been bothered by that behavior. I did get multiple compliments from the last couple of days from the residents because now they have seen the type of care that I give and the type of knowledge that I have. And at first I thought it was just because now they're getting used to me. But now I realize what the type of nursing that they're used to, and now what they're seeing with me and the other travelers that have come, because we've all come from different places, obviously. They treat the patients as if they're just meat. And it is appalling to me how they treat everybody, actually. I had a patient yesterday, or it wasn't mine personally, but I was involved with it. And the patient was acting a little crazy. I've had crazy patients before. That's nothing new. And part of it is he's COVID positive, so even when their drug screens come back, because we do a urinary drug screen on almost everybody, just to make sure, that it's not drugs that is causing them to act crazy. He was probably COVID positive, or maybe he could be crazy as well, on top of it, which is very possible. But anyways, he got up and he was acting crazy prior to that. I know that they had kind of restrained him for a little bit. And he had pulled out his IV, and so he was standing there with a gown on, nothing underneath, and blood spewing everywhere. And the charge nurse comes by and starts kind of yelling at him and stuff, kind of trying to calm him down. And so because that's just us, I come right away and try to help. So I kind of talk nicely to him, and she's grabbing onto his arm to try to stop the bleeding and stuff. And he was supposed to go somewhere, I don't know where, but they were putting him in a wheelchair to take him somewhere else. And like I said, he had nothing underneath, so he was flashing everybody. And so I said, hold on a second, because they were going to take him really quickly. And I said, hold on a second. Let me get a towel or a sheet so I can cover him up. And the charge nurse proceeded to say to me, as if I was a whore on the street, well, you've seen many dick. What does it matter? I did not say anything to her at that moment, because at first I was shocked to have another nurse talk to me like that, as if I was some whore on the street. And then the next thought was, what about this man's dignity? I don't care that he's acting crazy. He doesn't know that he's exposing himself like that to other people. And let's cover him up. Let's treat him like a human being, even though he's out of his mind. I was unable to get a sheet to help him, because they just whisked him off, flashing everybody as they go on, because this is an ER that does not have individual rooms. It's an old ER, so it's just a room with curtains. And this particular charge nurse, every single day, pushes all the curtains back and her responses so that she could see all the patients. Granted, you can hear all the patients, because 90% of them are moaning and crying out, saying they want to go home. It's very disheartening. I come out of there crying a lot, because they don't use sedation for these patients. I was talking to another nurse who was a traveler. She had a patient on the other side of the ER, not very far from me. And this man had been struggling for the last 2-3 days of trying to breathe. And, I don't know why my patient, they didn't give enough time to, which I felt like I could have given her a little bit more time before we got her on the vent. And this guy, they waited 3 days to intubate him, and he was struggling the entire time, even when he was on the ventilator, and absolutely no sedation was given. None. She was asking and asking, and nobody would give her sedation. One of the problems is because the residents, I'm not sure how it quite works. I'm assuming that it's because they have to ask their attending if they want to change plan or whatever, that before they order anything, they have to ask for permission. And so things don't get done in a timely manner, at least in the time frame, I should say, that I'm used to. When I ask for something, it happens. And so she was disheartened because this man was struggling. He's probably going to die, and absolutely no sedation. None. And they're just rough with the patients. I mean, I get these patients are low income, but you don't treat them the way that they're being treated. And, all our travelers have been, from other places that know how to take care of patients and have been from low income areas, but they still treat their patients with dignity. And it seems like we're trying to do that, but we're getting stopped at every, block. Maybe I'm not explaining it correctly. I don't know. I'm glad I waited, because I think you would have seen more anger come out, and it didn't need to be said like that. I think you just needed the knowledge rather than my emotion for this video, at least. This is not the type of nursing I wanted to do ever. Yes, I wanted to come here and help in a pandemic, and I was absolutely ready to have many patients and know that I would not be able to give a lot of the care that I wanted to give if I had a lot of patients. But now, because we have so many nurses there, and currently not a lot of patients, I'm able to give great care, and they're still not allowing us to do that. So I'm not quite sure why. It hurts my heart, and I know these other travelers, their hearts are hurt as well. I don't think I'll ever come back here to this state, to this area, and definitely not to this hospital ever again. So this is more than just COVID, I feel like, but I'm learning a lot about COVID. I just have this feeling deep down that I'm gaining this knowledge for a reason, and I think it's because it's going to be coming to Oregon, and so hopefully I can share my knowledge with those nurses there as well, because it doesn't present like we were initially told about respiratory. I mean, some of them have coughs, but they're all coming in with acute kidney injury without ever having kidney issues. All their D-dimers are elevated, so they look like they have PEs and they don't have PEs. You know, they're sick and they're out of their mind, because it does affect neurologically. Sometimes it affects their muscular, like their muscles, they're weak. And the other thing I noticed is that they're calling code strokes on them, and they're not code strokes. They're not strokes, but they're coming in with bilateral weakness, and the medics are calling it, code stroke. And I have never seen a stroke come in with both sides being weak. Usually it's one-sided. So, and they don't know timings, that's not like it's within a certain time frame. So, I don't know. You'd think these people would get it because they've been dealing with it for a long time, or maybe they've been dealing with it for so long and they're so tired that they're not reading the research or the things that are coming in from other people, the knowledge that other people are sharing there. I don't know if they're reading it or listening to it, but anyways, sorry for this video being so long, but I thought I'd just share. I will try to share again after today. Hopefully I have some other knowledge to share and not just raw emotions. Anyways, I hope you all have a good day.